According to recent reports, Attorney General Jeff Sessions is considering doing away with Obama administration rollbacks of the drug war, including reducing mandatory minimums for low-level drug offenders. Critics say Sessions is escalating the war on drugs when a growing number of people agree it has failed. As part of our ongoing series on the impact of the drug war in Baltimore and beyond, we recently sat down with Dan Morhaim, who has been a leading opponent of the war on drugs as a member of the Maryland House of Delegates since 1995. He's also been an emergency medicine physician for over 40 years, and he's on the faculty of the Johns Hopkins School of Public Health. This year, Morhaim defended himself against sanctions by the General Assembly Ethics Committee for not disclosing his interest in a successful application for a medical marijuana license, finding while he didn't break the law, he violated the spirit of them.
My entire perspective on the war on drugs comes from my clinical experience. I don't have fortunately, I don't have a family or personal experience. And let me say up front, I'm opposed to substance abuse, seeing the ravages of substance abuse, on people in many different ways. So in fact, when I first got elected back in 1994, I was strongly pushing for addiction treatment programs and passed the first major bill to support addiction treatment. But as a clinician, I've seen the ravages of the war on drugs, and I believe it's a failed policy. The ravages are on the general public, on innocent bystanders, the drug users themselves, and on their families. And we've had a policy going for 50 years plus that no one's for substance abuse, and I'm not, but that policy clearly isn't working. We're hardly in a position to pat ourselves on the back and say what a great job we've done addressing this problem. As you just pointed out, things are worse. Violence and homicides in Baltimore City and around the nation are up. The opioid overdose death crisis has become a major public health epidemic. So I think it's long past due time to analyze what we've been doing and say, it's not working, let's try some other approaches. My perspective is specifically to promote a public health approach and to start dealing with this problem that way. Not that we're going to solve the addiction issue or substance abuse issue. Human beings have been using substances since they've had consciousness. That's just, we like to change our consciousness. There's ways to do it. You can go for a walk, you can listen to music, you can play sports, you can pray, you can meditate. There are all kinds of ways. And choosing to use drugs is something that people have done for a long time, or alcohol, but it's not really the healthiest way. But we got to recognize that's been part of American culture for a long time. And my perspective is that we can decompress these issues. We're not going to solve them overnight. No one's that naive. But by taking some very specific steps that are evidence-based, I think we can make a huge difference in reducing the toll, personal, medical, financial, spiritual, that this failed policy has taken.
Was there a particular moment for you that opened your eyes or changed your perspective on this issue?
It's an interesting question. I do remember one. It was about 2 in the morning, and I was early in my career as an emergency medicine physician, and I was called to see a guy who had a laceration running down the side of his head. And as I approached the room, there's this odor that every emergency person knows. It's the odor of blood, alcohol, and saliva, and sometimes vomit. You can just smell this bouquet of odor. And I went in, and the guy had this giant laceration. And in the course of sewing it up, which I've done hundreds of, or maybe thousands, I guess, probably thousands at this point, I started talking with him. Tell me about the evening. And the evening started pleasantly enough. People were having a few beers, and then things got out of hand. Somebody made a crack that another person took exception to, and he was hit upside the head with a beer bottle. And I began to think more and more, how many of these situations I've seen that had an antecedent. It could have been nipped earlier in the bud. Drug overdoses. I remember an elderly woman pushed to the ground, broke her arm and shoulder as someone was stealing her purse. I talked to people who had a family member who the clock radio went missing. He was used to buy drugs. Never gets reported at the police, but they all knew that someone in the family had an abuse problem and had to feed their $50 a day habit. And I talked to a lot of the substance abusers themselves. And in the context of being a physician, we just have conversations. I'm not the police. They know they're not going to be arrested. And often these conversations would take place while I was doing some procedure on them, draining an abscess or sewing a laceration, and just chatting. And I was able, therefore, to get a lot of perspective that maybe others don't get. So I would ask addicts, how did you start using and why? And there is sort of the pyramid scheme of addiction. Everybody's trying to, trying to get somebody else addicted so they can make money on theirs. How much does it cost? $20 to $100 a day, times 365 days a year. If we use Baltimore as an example with 20,000 hardcore daily users, do the math, that comes out to almost $400 million a year just to buy the drugs. That doesn't count police, court, jail, all the other healthcare costs. And I would ask them, would you like to get into a treatment program? And overwhelmingly, they said yes. And I also recognize there's some folks that are just hardcore. I wish we could help them. We can't. Just like there's diseases people get, we try to help, but we're really not going to be curative. But even if we got a half of those people who wanted to get into drug treatment into a treatment program tomorrow, you get the payback immediately. If someone goes into a treatment program on a Monday, Tuesday, the harm reduction, things that they're likely to do, decrease substantially because they don't have to come up with $50 a day to maintain their habit. And where are they going to get that money? So they're very clear strategies that are cost effective. It's not going to solve the problem overnight. No one's that naive. But going back to the 20,000 hardcore users in Baltimore City, and there's many more around the state. I don't want to just pick on the city, but it's in every jurisdiction in the state. If you got 5,000 into a treatment program tomorrow, which is a very doable thing, overnight you would decompress a considerable amount of the harm that this situation has been causing us.
And so you've been an advocate of reforming the drug war on a state level. And we know that there is considerable opposition to that, especially from police unions and prison guard unions. They have a lot to lose if the war on drugs is ended. Talk about what your efforts have been and what the opposition looks like in Annapolis.
Like so many things, when you promote new ideas, you do run the risk of getting opposition. And there are people opposed for a variety of reasons. This would be a radically new way of thinking. I understand that. And even some of the things that I now believe, I probably didn't support 5 or 10 or 15 years ago. For example, safe consumption facilities, which I put in legislation the last 2 years. You could say this is a place where addicts go to shoot drugs, and we're enabling and allowing that and supporting that. On the other hand, the evidence shows that clearly they reduce the rate of addiction, reduce the rate of crime, get people into treatment, make neighborhoods safer, fewer syringes on the street. Every so often, you've got to go with the evidence and the facts and change your thinking. So I understand the reticence and the political concerns that people have. All I can do is persist and try to persuade them. But we've seen changes like that before. I mean, when the first tough bill I voted on in 1995 was as heavily lobbied as anything. People said, if you support this, it'll be terrible. If you don't support it, it'll be terrible. We passed the bill. It was to ban smoking in restaurants. We were told we would all the restaurants in D.C. area, Maryland would close, Baltimore City would close down. Well, we banned smoking in restaurants, business went up. The opposite occurred. And I think the same thing here too. Look at issues like marriage equality or wearing a seatbelt. The worst night in my life as an ER doctor was 3 kids killed in a car accident because that was before bucket seats and baby seats and kids were restrained. So we don't allow that. We don't let that happen. No one would say, "Oh, just let your kid run around the back seat of a car while you're driving." But that was the way it was 20, 30 years ago. So I think there's a change here that's taking place. People are beginning to think about it. I don't have all the ideas. There's lots of good ideas out there, but it's time. It's well past time that this issue be confronted head on. Tragically, the crisis that's happening now with opioid deaths spread throughout the state, throughout the United States, is bringing new attention. And I think there's a little bit of change of thinking in the legislature here and maybe elsewhere. Unfortunately, the federal government seems to be taking steps backwards.